Hi, Casey.
Hi.
My name is Dr. Matt. I'm going to do your exam today.
Okay.
So you're here for your annual medical exam?
Yes.
Alright, can you please verify your first and last name and your date of birth?
Casey Smith. Date of birth is January 27, 1993.
Perfect. Do you have any allergies to medications?
Amoxicillin and Ceplex.
Okay. Any surgeries that I should have on file?
No.
Are you taking any medications on a daily basis?
Vitamin B and vitamin C.
Were you told that you're deficient in vitamin B?
No.
Any medical history that I should have on the medical record?
No.
Okay, and anything in particular that we should address today?
Yes, for the last 3 months I've been having swelling in my hands and feet.
Okay. For the last 3 months. Have you noticed any palpitations or difficulty breathing?
No.
Okay. Any shortness of breath? Are you experiencing a new onset of cough?
No.
Okay. Have you noticed any changes in your vision?
No.
Okay. I'm going to go ahead and begin the exam. I will take your vital signs first. So this will go on your left upper arm. We'll take your blood pressure. Okay, I'm going to have you relax. This will go on your index finger. Blood pressure is normal 125/60. Okay. I'll take your temperature as well. 98.4 Fahrenheit. Heart rate 85. Oxygenation 98% on room air. That's very normal. And have you noticed just your hands and feet being swollen? Does it go all the way up the arm?
Just my fingers and toes.
And are you experiencing any pain?
No pain but tingling sensation.
And have you had any recent changes in your diet?
Not that I'm aware.
Are you consuming maybe a lot more sodium with your foods than normal?
It could be. I use a lot of salt for seasoning.
Okay. I'm going to listen to your heart first. I'm going to have you breathe normal for me. Is it okay if I put the stethoscope under the shirt? Okay, go ahead and take a deep breath in now. And exhale. And again, take a deep breath in. And exhale. Okay. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay, very good. I'm going to listen to the sides as well. I'm going to have you lift this arm a little bit. Take a deep breath in and exhale. And on the other side. Take a deep breath in and exhale. Okay. Perfect. Alright, I'm going to have you lay down and change in this gown.
Okay.
I'm going to go ahead and start by palpating your face. I want to see if there is any swelling. Going to palpate the sinuses above the eyebrows. And under your eyes, just gently applying light pressure. I can definitely feel the sinuses on each side of the nose. palpating the orbital area for swelling. Going to palpate lymph nodes. Sometimes if there is an infection in the body or lymphatic system, it definitely shows symptoms, and it alerts the immune system that it's time to defend our body. Palpating each set of lymph nodes under the chin. Behind the ears. And in front. Going down the neckline, I'm going to palpate the trachea. I want to make sure that it is midline with the neck. And now I'm not feeling any lumps. Checking the thyroid gland. I'm going to have you swallow one time. Perfect. Thyroid gland is non-palpable, which is a good sign of healthy gland. Okay, perfect. Face is symmetric. I'm not noticing any cyanosis around the mouth. Non-palpable lymph nodes. And most importantly, I'm not noticing any swelling. Also didn't see any redness. So it doesn't seem to be a skin infection. I'm going to check for any abnormal neurological responses. So what I'm going to do is I'll slowly tap on the bony prominences. Can you go ahead and tell me on which side of your face you feel this? Right, left, right, left, left, right, 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 left, 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 right, right, left, right, 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 left, left, left. Okay. I'm going to touch you with two textures. One is going to feel sharp, the other one is going to be dull. This is what sharp is going to feel like, and this is what dull is going to feel like. Sharp, dull, 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 sharp, sharp, dull, dull, sharp, sharp, dull, dull, sharp, 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 dull, 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 sharp, sharp. I'm going to take a few measurements. Looking for a symmetry. I'm going to go ahead and palpate your head now and just take a look at your scalp. I want to make sure that there is no inflammation there as well. Palpating for any bumps or lumps that cannot be seen but can be felt. Okay, I'm going to have you turn your head towards the left to take a look at the posterior side of the head. Palpating the masseter bone behind the ear. So looking for swelling. I am feeling the occipital lobes. I'm going to have you turn your head now towards the right. A little bit of redness behind the ear. Head is normocephalic. Not feeling any evident lumps. Also, it's symmetric on both sides. Now I'm going to take a look at the scalp area. very healthy scalp. I'm not noticing excess oil, no dandruff, not noticing any redness. I'm going to do a sensory test. Go ahead and tell me when you don't feel the vibration anymore. Go ahead and tell me if you feel this cold or warm.
Cold. 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 Warm. Cold. Warm. Warm. Cold. Warm. Cold. Cold.
I'm going to move a little bit more towards the right side. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp.
And does this feel sharp all the way?
Yes. Dull.
Does this feel dull all the way?
Yes.
Okay, I'm going to have you turn your head towards the left. I'm not noticing any redness around the scalp area. Go ahead and tell me if this feels sharp or dull.
Dull. Sharp.
Does this feel cold or warm?
Warm. Cold. Cold. Warm.
I'm noticing normal neurological responses. I'm going to go ahead and do an abdominal exam now. I'm going to take a look at the abdomen to see if there is any redness or swelling. I'm going to use a wooden spatula to also look for any raised bumps. Skin looks very well perfused. I'm going to use a stethoscope to listen to the digestive tract. This is going to feel a little bit cold. Starting with the right lower quadrant. Moving to the right upper quadrant. Listening to the left lower quadrant. And the upper left quadrant. Listening to the abdominal aorta for any bruit. I'm going to slowly palpate the main organs using a circular motion. going to go ahead and percuss. I'm going to go ahead and first examine using the light. Looking for abnormal skin lesions. I'm going to use a wooden spatula to inspect the skin. Looking for any raised bumps. I'm definitely noticing the swelling. Also looking for redness, signs of cellulitis. I'm noticing a slight increase in redness as we're approaching the foot area. Also looking for any varicose veins or signs of a DVT. checking for pitting edema and neurological responses. I'm going to have you lift your left leg a little bit. One more time. Checking calf circumference. I'm going to go ahead and compare with the right side. Go ahead and relax. Go ahead and relax. Going to check pulses. Two pulses strong and synchronizing. I'm going to listen out. We're looking for any abnormal flow, something that would indicate an obstruction. I am noticing a little bit of arterial deficiency. going to check Babinski reflex. Can I have you relax your foot? Okay. I'm going to go ahead and just slowly palpate the base of the foot to feel for any extra swelling or fluid retention. Checking capillary refill. It's within 2 seconds. Just want to make sure that we're comparing left and right. Okay, I'm going to go ahead and examine your back now. I'm going to first listen to your lungs. We're checking for any pulmonary edema or signs of cardiac tamponade. Going to percuss. Looking for any fluid retention. I'm going to slowly palpate, starting with cervical spine, feeling for any lesions. Checking scapula for asymmetry. measuring spine. Slight asymmetry. I'm going to check for any neurological abnormalities. Tapping on the bony prominences to see if there's any neuromuscular movement. Go ahead and tell me if you feel this 2 pressure points or 1.
2, 1, 2, 2, 1, 2, 2, 1, 2, 1, 2, 1, 1, 1, 1, 1, 1, 1, 1, 2, 1, 1, 1, 2, 2, 1, 1, 1, 1, 1, 1, 1, 1.
I'm going to go ahead and switch gloves. Alright, I'm going to take a look inside your throat first. I want to see if there is any redness there. Go ahead and give me a big just slowly pressing down on the tongue. That's good. I'm not seeing any redness. Go ahead and move your tongue left to right for me. Good. And up and down. Good. Symmetry is perfect. I'm going to have you give me a big smile. Good. And frown. Puff your cheeks for me, please. Keep them puffed. Don't let me unpuff them. Go ahead and relax. I'm going to put my hands on your shoulders. I'm going to have you shrug them on the count of 3. 1, 2, 3. Go ahead and relax. Okay, I'm going to have you squeeze my fingers. Good. I'm going to have you put your arms in front of you and try to resist me pushing, okay? Okay. I'm going to try to open them. Don't let me do that. Alright. Go ahead and relax. I'm going to go ahead and slowly palpate your hands and your arms. I'm looking for edema and the swelling that you are concerned of. Go ahead and relax. Capillary refill is within 2 seconds. Going to lift the cone a little bit higher. Okay, I'm going to support your arms, so go ahead and relax. I'm noticing a little bit more redness on the right hand. I'm going to lift the gown up a little bit. Keep your eyes closed and tell me when you don't hear this sound anymore. Stop. Stop. Now go ahead and tell me which position here is louder to you, position 1 or 2. This is position 1 and 2. Which one was louder?
Can we try that again?
Yes. Position 1, 2,
2.
1, and 2.
2.
Perfect. I'm going to give you a few taste. And I'm gonna have you identify what this tastes like. I'm gonna have you open your mouth. Go ahead and close. What does that taste like?
Pepper.
Okay. One more.
Orange.
Go ahead. Okay. Go ahead and open your mouth one more time.
Bitter.
And again.
Cherry.
Okay, I'm going to go ahead and check your olfactory nerve. Go ahead and take a deep breath in through your nose and out through your mouth.
Cinnamon.
And one more time. Breathe in and breathe out.
Lavender.
Alright, Casey. I'm going to send you for a cardiac evaluation.
Okay.
I want to make sure that you don't have any DVTs, which are blood clots, like in your arm or your legs. So they're going to do for sure an ultrasound to check for thrombosis. And we're going to do some blood work as well, okay? Otherwise, I did not find anything concerning. And even with that, the swelling seems to be a little bit more diminished. Like, it was very hard for me to distinguish it. I did see it, but I think it's slowly fading down, which might indicate maybe just a fluid imbalance. We're also going to go ahead and check your kidneys. I want to make sure that everything is functioning properly. Do you have any questions for me?
No.
All right. It was very nice to see you again.
Nice to see you. Thank you.
Thank you as well. Good. Sharp. Tall.
Tall.
What about now?
Sharp. 2. No.
Left. Hi, Andrea.
Hi.
I'm Dr. Matt. I'm going to do your annual checkup today.
Nice to meet you.
Nice to meet you too. May I please have your last name and your date of birth?
Miller. Date of birth is December 7th, 1982.
Perfect. Do you have any allergies?
I do not.
Okay. Are you taking any medications on a daily basis?
Just vitamins.
And when was your last checkup?
About 6 months ago.
Okay. Are you experiencing any pain at the moment?
I do have headaches once in a while,
Okay.
especially on the back of my head.
And are they constant or they come and go?
They come and go.
And you said it's been going on like this for a month, right?
Yes.
Okay. Are you taking any medicine for this sometimes?
I do take ibuprofen once in a while, but I try not to that much.
Have you had any surgeries or any accidents in the last 12 months? Okay. family history of headaches or neurological disorders?
Yes, my mom has migraines.
Okay. And do you remember when she was diagnosed with that?
Oh, a long while ago when I was little.
Okay. All right. We're going to go ahead and take your vital signs and do a checkup to see exactly what is triggering your headaches.
Okay.
I'm going to have you just take the blood pressure. This is going to go over your arm. Let's go ahead and use that one. Yeah. Okay, go ahead and relax. All right, I'm going to have you relax. Blood pressure is a little bit on the low side, 95/60. Are you
I
feeling
always
okay?
had it on the low side.
Okay. I'm going to take your temperature. It's going to go over your forehead. 98.7. That's perfect. Just going to go on your finger. It's going to measure your oxygen and your heart rate. .75, that's perfect. And the oxygenation is 95% on room air. Perfect. Okay. Okay, I'm gonna put gloves on and I'll do an eye examination. Sometimes headaches can be triggered by vision changes that are not expected. So we're gonna do an ocular reflex test. I'm gonna have you look straight right here in my nose. Just try not to blink. Good. Good. So that's normal. Okay, go ahead and look straight at my nose. I'm gonna flash a light in your eyes. We're just looking for pupil dilation and constriction. Okay, just gonna lower on your eyelid a tiny bit, just looking for any redness. Go ahead and look up. Okay. All right, I'm gonna have you follow the light with your eyes only. Don't move your head. Okay, now I'm going to bring the pen light very close to your nose. I'm going to have you follow the tip of the pen light. One more time. Okay. Now I'm going to have you look right over here, a little bit higher. And same thing on this side. Okay, no ocular movements, that's good. Okay, I'm gonna have you change into a gown and I'll have you lay down on the table and we'll do a full body exam.
Okay.
Okay, Andrea, I'm gonna go ahead and first examine your face. So we're looking at the main muscle points that could trigger a tension in the scalp and neck area. And that's some of the most common causes for headaches. Are you experiencing any pain with chewing?
No.
Just slowly palpating the sinuses in between your eyebrows. Looking for any tension, fluid buildup, tenderness. Okay, checking sinuses right under your eyes. I'm not noticing any fluid buildup. Checking lymph nodes for any lymphadenopathy. Looking at pre and post-auricular lymph nodes. Supplemental lymph nodes. Sublingual lymph nodes. Checking trachea to see if it is midline or any deviations to the right or left of the axis. Palpating the thyroid gland for any nodules or swollen. I'm gonna have you swallow one time. Perfect. Checking supraclavicular lymph nodes for anything swollen. Checking mastoid bone for signs of mastoiditis. I'm just going to gently press down on your TMJ. I'm going to have you slowly open your mouth all the way up, all the way, a little bit more. Just a little bit of clicking there. Go ahead and slowly close it. And I'll have you do that one more time. Slowly open on the left side side. They're both clicks. Go ahead and close. Okay. I'm going to run an MRI after this to check for any cartilage deterioration, to see what grade of disorder we have. It could be from 1 to 4, 4 being the worst. But since you're not having any pain yet, I would say it should be like a 2, and it's right on time. We can definitely treat this. I'm gonna have you keep your eyes closed and tell me what this smells like. I'm gonna close your right ear. And I'll have you breathe in through your nose and out. Are you able to identify this smell?
No.
Okay. Let's go ahead and check the right ear now. I'll have you breathe in and breathe out. What does that smell like?
Alcohol?
Okay. Go ahead and check your taste. Have you noticed any changes?
No.
Okay. This is gonna go on the tip of your tongue. I'm gonna have you open and taste. Go ahead and close. Open. What does that taste like?
I don't feel any taste.
Okay. Just go ahead and try one more. Go ahead and open. Close. And open. What does that taste like?
Still nothing.
Okay. So let's go ahead and check your facial sensation. I'm going to touch you with 2 textures. The one is going to feel dull, and the other one's going to be sharp. This is what dull is going to feel like, and this is what sharp is going to be like. Okay. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp.
Does this feel the same as this?
Yes.
And does this feel the same as this?
No.
Does this feel the same as this?
No.
Does this feel the same as this?
Yes.
Okay, so that looks good. I'm gonna go ahead and check your scalp to see if there is any asymmetry or any skin abnormality. So first we're palpating to see if there are any lumps or bumps and checking for scalp symmetry. I'm going to turn your head to the right. I'm going to listen to your heart. Is it okay if I slide the stethoscope under the gown?
Sure.
Okay. I can hear only S1 and S2. No S3, no S4. I'm gonna have you take a deep breath in through your nose and exhale. I'm gonna check for murmurs. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Checking for any jugular vein distension. I'm not listening to any brewy, no signs of heart failure. All right. Scalp is on the dry side. Noticing a little bit of yellow discoloration and drier patches. I'm going to do a sensory test to see if there is any sensation loss on the left side. Go ahead and tell me if this feels dull or sharp.
Dull.
Was that sharp or dull?
Dull.
What about now?
Sharp. Sharp. Dull. Dull. Sharp.
Do you feel this dull all the way down?
Yes.
Go ahead and tell me how many taps you feel. 1, 2, or 3.
2. 2. 1. 2, 1.
Okay, does this feel sharp or dull?
Dull.
What about now?
Sharp.
And now?
Sharp. Sharp. Sharp.
Okay, gonna have you turn your head to the left. To apply a basic solution. It's gonna help to remove the dry skin cells. We're gonna make sure that we distribute this solution to the area that we want to collect the cells. This is a sterile cotton swab. We're going to collect what we were able to extract. going to send this to the lab. It's going to take about 24 to 48 hours that we get the results, and I'll let you know. Okay, I'm going to check your hearing now. So we want to see if there is any discrepancy between left and right. I'm going to create a tuning fork sound. Go ahead and tell me when you don't hear this sound anymore. You can just say now.
No.
Okay.
No.
Okay. Now go ahead and tell me if you hear which sound you hear louder. Position 1 or 2.
2.
Same thing on this side. Position 1 or 2.
2.
Okay. Now tell me with which ear you hear this sound, left or right.
Right. Right. Left. Left. Both. Both. Right. Left. Left. Right.
Okay, wonderful. So there is no impaction on the hearing, no hearing loss. I'm going to go ahead and check your abdomen, and let's see if there's any pain there. Starting with the left lower quadrant. Normal vowel sounds. I'm not noticing any hyperactivity. I'm going to slowly percuss. Let me know if you feel any type of pain. a very slow palpation. Let me know if you feel any pain or looking for tension, rebound tenderness, and any swollen organs. Liver size is normal. Okay, perfect. No tenderness around the umbilicus area. I'm not seeing any redness. So no signs of peritonitis. Alright, I'm just gonna go ahead and lower the gown. Okay, so just slowly palpating to see if there is any asymmetry. Also looking at temperature. And if we're noticing any peripheral edema, especially looking around the ankles. Okay, I'm not noticing any diaphoresis, no swollen glands. Okay, pedal pulses are strong, 2 plus. Go ahead and tell me if you feel this vibration.
I do.
Okay. What about now?
I do.
Right. Go ahead and tell me when it stops.
It stopped. Stopped.
Okay. Could you take a few measurements? Just gonna have you lift this up and relax. 65. Gonna have you lift up and relax. Good. We're going to go ahead and check your reflexes. Okay, go ahead and relax your foot. Good. Relax. Good. Okay, I'm just gonna bend this knee over your left leg, just like that. Good. Okay. Same thing on the other side. This needs to be dangling just a little bit more. Okay, perfect. Okay. Let's check your Babinski reflex. Go ahead and relax. Just gonna feel a little bit of sharpness on the sole of your feet. Good. Okay, perfect. I'm going to check the strength of your legs. gonna have you pull your feet towards you and as strong as you can. Okay, perfect. I'm gonna have you push in with your pads. Good. I'm going to slide my hands under your heels. Okay, I'm gonna have you push. Okay, a little bit stronger on the right side, but that's normal. All right, I'm gonna try to open your legs. Don't let me do that. Good. I'm gonna try to close them. Don't let me do that. Okay, perfect. And now I'm gonna try to push down while you're pushing up. Okay, good. Okay, a little bit weaker on the left side. I'm gonna have you tell me if you feel this all the way up.
I do.
Okay. And do you feel this all the way up?
Yes.
Okay. Does this feel the same as this?
Yes.
Okay. Do you feel this vibration?
Yes.
Tell me when it stops.
I do.
Okay. Same thing. Tell me when it stops.
Stopped.
Good. Okay. Very normal results. I'm gonna have you flip over now and I'll take a look at your back. I'm going to listen to your lungs. I'm gonna have you take a deep breath in through your nose and slowly exhale. And again, breathe in and breathe out. No signs of pulmonary edema. I'm going to percuss. I'm going to palpate cervical spine, starting with atlas, moving down to axis, C3 and C4. Looking for any deviation of the spine to the left or right. No signs of scoliosis or lordosis. I'm going to check skin turgor. This helps to determine if there is good hydration and nutrition. again. I'm going to take a few measurements. We're checking for asymmetry. Okay, this is going to feel like a benching sensation. Checking for skin darker again, and any asymmetry in the left or right. The right side definitely looks better. I'm going to check your neurological responses. I'm looking for any internal deficits. I'm not noticing any abnormal responses. I'm going to draw a letter on your back. Go ahead and tell me if you can identify it.
N. B. C. Z. M. D. R.
Okay, perfect. I'll have you sit back up on the table and we'll do one last checkup. going to check your reflexes. So what I'm going to do is I'll slowly tap on your chin. I'm going to have you relax. Relax your chin a little bit more. Slightly open. Good, there you go. Okay. All right, I'm going to have you relax your arm. Okay, a little bit diminished on that side. Go ahead and relax. I'm going to have you flop it like this. Good. Good. Relax. Okay. Good. Okay. Okay. All right, now I'm going to have you put your arms in front of you, just like that. So I'm going to have you squeeze my fingers as strong as you can. Okay, good, bilaterally. I'm going to push down on your arms. Don't let me do that. Good. Now I'm going to try to push them up, but don't let me do that. Okay, weaker on the left side. I'm going to try to open them. Don't let me do that. And close. Okay, I'm going to have you spread your fingers out like that. I'm going to try to close them. Don't let me do that. Good. Spread them out. Okay. Okay, good. Go ahead and relax. I'm going to have you shrug your shoulders like this. Good. And now I'm just going to press on this side of your cheek and I'm going to have you resist. Okay. Good. Same thing on the other side. All right. I'm going to have you look down. Okay. Good. All right, Andrea. Everything looks good. I'm just going to run an MRI to see exactly how your TMJ looks. Okay. And I think that's where your headaches are coming from. I'm going to write all of this in your chart. So I'm going to make a new file for you and make sure that we have this information ready for the next checkup. Okay. And I will give you a call back with the results from the MRI, okay?
Great, thank you.
You're welcome. Very nice to meet you.
Likewise. Thank you.
Give me a big now. Left. Cold. Cold. 2. Sharp. Dull. Hi, Skylar. My name is Dr. Matt. I'm going to do your exam today. How are you feeling?
Oh, I'm feeling all right.
Okay. I have here a new file for you, so we're going to go ahead and just verify some information that we have from your previous doctor.
Mm-hmm.
Okay. Can you please verify your last name?
It's Ashland.
And your date of birth, Mrs. Ashland?
It's January 14th, 2000.
Okay. Do you have any allergies?
No.
Are you taking any medicine on a daily basis?
No.
And when was your last checkup?
It was 6 months ago.
Okay. Anything in particular that you would like to address today?
I'm having some numbness in my back and also some vision changes.
Okay. For how long have you been having the vision changes?
The past month or so.
Are you experiencing any blurriness?
Yes.
Is it in both eyes or just one side?
It's in both.
Okay. You said 1 month.
Does it come and go, or is it constant?
It comes and it goes.
Okay. Have you noticed any floaters or any dark spots in your vision?
No.
Okay. Do you wear contacts?
Yes.
When was your last vision checkup?
It was 3 months ago.
And anything in particular at that exam that you recall?
Just the same.
Okay, tell me a little bit more about your back pain. For how long has it been going on?
Sure. So I started noticing it maybe a month or 2 ago.
Okay. And is it constant or it comes and goes?
It's constant.
Constant. On a scale of 0 to 10, how would you rate your pain?
Maybe a 6.
6, okay. Are you taking any medicine to manage your pain?
Just a Tylenol.
Okay. And does that work for you?
It helps, but I still need some help.
Okay. All right. Have you noticed any numbness or tingling sensations in your fingertips or your toes?
Oh, yes, I have.
Okay. In your toes or your fingertips or both?
Both.
Both. On both sides or one side?
On both.
Both sides. Okay. And has that been going on in the same time with the back pain?
Mm-hmm.
Any car accidents that you remember?
Yes.
When did that happen?
Oh, it was 3 months ago.
Okay. And were you hospitalized?
No.
Any broken bones or any major injuries from the accident?
Just a fender bender.
Do you remember hurting your head or losing consciousness?
No.
Okay. So I'm glad that you came in for this checkup. We're going to do a full body head to toe exam to make sure that we're not missing any symptoms. And we're going to start with vital signs. Okay. This is going to go on your upper arm. Okay, go ahead and relax your arm. Okay, this is going to go here. You're going to feel kind of like a squeeze. Any hypertension in the family?
No.
I'm going to put this on your finger. I'm going to check your oxygen and your heart rate. I'm just going to slide this down. I'm going to take your temperature. .5. That is a little bit high. Have you had any flu-like symptoms? Okay. Oxygenation is 98% under the air, and heart rate is 80. That's normal, but blood pressure was a little bit borderline. I would say it was 138/70. 5. Okay, I'm going to check your mouth. So I'm going to see if there is any signs of redness or infection, something that would explain maybe the slight low-grade fever.
Give me a big ah. Okay.
So I'm not noticing any white spots. Doesn't seem like it could be strep. Okay. I'm going to check your vision since this is one of the major concerns that you've been having. So you notice that you're seeing a little bit of blurriness. Is that far away or close up?
Far away.
Far away, okay. Go ahead and look straight in at my nose. I'm going to flash a light in your eyes. Good. Okay, pupils are round and reactive to light and accommodating. I'm going to go ahead and just slowly press down on your eyelid and check if there is any yellowish discoloration. Look up. Okay, look up. Good. Go ahead and look right here. Okay. I'm going to bring my fingers into your field of vision. Go ahead and tell me when you start seeing it, okay? Can I have you cover your right eye first with your right hand? Perfect. Go ahead and tell me when you see my fingers in your field of vision.
Now.
Okay.
Now. Now.
Okay. Let's go ahead and switch eyes.
Now. Now. Now.
Okay. So there's a little bit of peripheral vision loss as well. Let's go ahead and do that one more time. I'm going to have you cover your right eye. And can you please tell me how many fingers I'm holding up?
2. 1.
Okay, let's go ahead and switch. Same thing. How many fingers?
2. 1.
Okay. Go ahead and uncover. And now go ahead and follow the light with your eyes only. Don't move your head. Okay. A little bit of rapid movement, but I would say nothing out of the ordinary. Okay. Any pain when you're moving your vision?
A little.
A little. Okay. Going to go ahead and check your optic nerve. So I'm gonna have you look behind me straight at the wall. I'm just gonna come very close and shine a light in your eye.
A little bit of inflammation in the back of the retina. That might put some constriction on the nerve and block blood flow.
Let's check the other side. Okay, so go ahead and look same.
Right side looks a little bit better. Less inflammation. Just a little bit of retinal scratch.
But that could be related to age as well. Let's go ahead and listen to your lungs and heart. At the it's gonna feel a little bit cold, I'm gonna have you take a deep breath in, okay? And breathe out. One more time, breathe in. Breathe out. And again, breathe in. And exhale. I'm going to listen to your heart. You can go ahead and breathe normal. I can hear only S1 and S2. No S3, no S4. I can go ahead and switch with the bell. I'm going to have you take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay. I'm going to have you change into this gown, and I'm going to start with the back to do a back examination. Also, make sure that there is nothing neuromuscular happening. So we're going to do a very good spine checkup for you, okay? I'm going to put gloves on first. Then I'm going to put your hair up so that I can take a look at your back. A little bit of swelling on the left side. Okay. Going to start with cervical. I'm going to feel just 2 fingers. I'm going to try to examine C1 and C2. Looking for swelling, signs of inflammation. Very normal curvature at the cervical junction. I'm not feeling any nodules. But I would say thoracic, it is slightly forward.
take some measurements and see if there's any asymmetry. Slight protrusion on the right side at the scapular angle. You're gonna feel a slight pinching, just looking for asymmetry. Slight inflammation on the right upper side at T3 and T4. And slight redness, a little bit of decreased circulation in that area. I'm going to listen to your back. I'm going to have you take deep breaths in for me, okay? Every time you feel the stethoscope. Okay, breathe in, breathe out. Again, breathe in, breathe out. Okay. One more time. Breathe out. You can breathe normal. Just going to listen to your spine. We're looking for microscopic friction rubs that could indicate a lack of circulation in the area. I'm going to do a neurological assessment. You're going to feel light tapping and for any changes in movement.
normal. Good to go ahead and check your sensations on your back. Please tell me if you feel this on the left or right.
Left. Right. Right. Left. Right. Right. Left. Right. Left. Right. Right.
Okay. Does this feel cold or warm?
Cold. Cold. Warm. Cold. Warm. 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 Cold. 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 Warm. Warm. Cold. Warm. Warm. Cold.
I'm going to touch you with 2 or 1 pressure points. Go ahead and tell me if you feel this 2 or 1.
1. 1. 2. 2. 1. 1. 1. 2. 2. 2. 1. 1. 1. 2. 1. 1. 1. 1. 2.
Do you feel this 2 or 1 or 3 taps?
3. 3. 1. 1. 2. 2. 2. 2. 2. 3. 1. 1. 1. 2. 2. 2. 1. 1.
I'm just going to go ahead and palpate this area. Seems like we did find out what it is and where exactly it originates from. This plexus is definitely known for causing numbness, especially in the arms. Okay, I think I can have you lay down now. I'm going to palpate your lymph nodes, starting with preauricular.
anything swollen. This could be a salivary gland stone. Beating trachea to check if it's midline. And the thyroid gland is not palpable, not feeling any nodules, not seeing any redness. I'm going to palpate right above the clavicles. Checking sinuses. And right under your eyes. There's a little bit of inflammation on the pair of sinuses that are lateral to the nasal septum. Just palpating the hairline. There's normal hair distribution. Say normal scalp movement. Doesn't seem to be any vascular constriction. Normal movement. Okay, I'm going to do a scalp checkup. There's a little bit of redness more towards the middle of the crown. I'm already noticing some flakiness, but the redness is not localized, so it could be from sun exposure. Go ahead and tell me if you feel this on the left or right of your part.
Left. Right. Right. Left. Left. Right. Right. Left. 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 Right.
Does this feel cold or warm?
Warm. Warm. cold, cold, warm, cold, cold. Go ahead and let your head move a bit. Okay. I'm going to do the same thing on the left side of your scalp. Does this feel cold or warm? Cold. Warm. Warm. Cold. Cold. I'm going to touch you with two textures. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to be dull. This is what dull is going to feel like. Go ahead and feel this sharp or dull. Sharp. Sharp. Dull. Dull. Okay. I'm going to check the other side. I'm going to take a sample here from this side. There's a little bit of dryness and dandruff, which is really good because we're going to be able to get a good sample. Very good movement on the scalp, I would say. I'm going to send that to the lab. Okay, just light palpation, looking for asymmetry. And any bumps on the skin. I'm going to check your smell. So we're going to do an olfactory nerve test. Go ahead and take a deep breath in through your nose and out through your mouth. And what does that smell like for you? It smells fresh.
Okay. One more time. that one?
It smells floral.
What about that one?
It smells like cinnamon.
Okay. Let's try one more.
It smells like pine.
Okay. So I would say there's nothing neurologically going on with your nerves. I'm going to go ahead and check your abdomen and then check your legs and reflexes. I'm going to check for any swelling on the abdomen. Okay, there doesn't seem to be any edema. I'm going to listen to your abdomen first. This is going to feel a little bit cold. Checking the lower left quadrant first. Have you noticed any abdominal pain?
No.
Normal bowel sounds. I'm going to percuss. Let me know if you feel any pain.
Okay, I'm just going to slowly and gently palpate, starting with the right lower quadrant. Just checking size of major organs. That looks very normal. Checking to see if there is any separation in between the abdominal walls. That's definitely extremely rare in your age group. Okay. Checking kidneys. Just going to go ahead and check your legs. Just going to slowly palpate, see if there is any swelling. There is a little bit of swelling, I would say. And we definitely need to minimize salt and elevate the legs whenever possible. That's going to prevent from the blood to not stagnate in the lower part of the body. Just going to slowly palpate. I'm going to check your reflexes. So the right leg, I'm going to bend it over the left one. Perfect. Relax. Okay. Same thing on the other side. Just go ahead and bend this a little bit more. Perfect. Okay, relax. Going to check your Babinski reflex. Okay, just relax your foot. Good. Good. So I'm not noticing any flare-ups. Go ahead and push with your pads towards me. No, leave your feet down. Just push towards me. Push, push. Okay, perfect. And now go ahead and pull your feet towards you. Okay, a little bit stronger on the left side. Okay, that's good. I'm gonna try to open your legs. Don't let me do that, okay? Okay, I'm gonna try to close them. Don't let me do that. Okay, I'm gonna have you flare up your toes like that. Okay, now go ahead and wrap your toes around my finger. Okay, a little bit of diminished on the left side there. Can you please tell me if I'm moving your toe towards you or towards me? Towards me. Towards you. Towards me. Towards you. Okay, everything looks good. I'm gonna have you sit up and we'll talk about results. Okay. So we're gonna run some blood work to make sure that everything looks good. But I did not notice anything neurologically happening and your physical looks very healthy. I'm gonna have you come back in about 2 weeks. If your symptoms do not resolve, we're definitely gonna go ahead and run more tests. But let's see what the blood work shows for now, okay? I'm just gonna make some checks here in your chart. Do you have any questions? Would you like to run more tests?
No, I think you answered all my questions.
Okay, perfect. Thank you so much, Skylar, for coming in, and I'll see you back in 2 weeks, okay?
Great, thank you.
Hi, Amanda.
Hi.
It's lovely to see you again.
Good to see you too.
Thank you for coming in. We're gonna do a head-to-toe examination today. Can you please go ahead and verify your last name
Johnson.
and your date of birth?
It's July 22nd, 2000.
Any new allergies?
No.
When was your last medical checkup?
About a year ago.
Okay, any surgeries in your lifetime?
In my lifetime, yes. About like 15 years ago, I had surgery on my elbow.
Okay, and how is that healing right now?
It's good.
Perfect. Which one is it? Right or
Left.
left? Was it because of an accident?
Yes.
Bike ride?
I was from a trampoline.
Are you taking any medications on a daily basis?
Not on a daily basis. I take ibuprofen when I need it, but that's the only thing.
Okay. Any vitamins?
No.
Birth control? Are you experiencing any pain anywhere in the body?
Not regularly. Sometimes my back hurts off and on, but other than that, nothing.
And any hospitalizations in the last couple of months?
Not in the last couple months, no.
Did you get the flu vaccine
Yes.
this year? Okay, so you're up to date with that. Any family history of hypertension, hyperlipidemia,
Not that I know of, no.
thyroid disorders?
No.
Okay. Anything in particular that you would like me to address today?
I've been having some issues with my skin, with like eczema and stuff like that, especially with the colder weather.
Okay, absolutely. I can take a look and see what kind of bumps I find on the body and see how we can help you today. I'm going to sanitize my hands and start with vital signs. Any flu-like symptoms in the last 2 weeks?
No.
Okay. It is the flu season, so we want to stay home when we are sick. This is gonna go on your forehead. 98.0, perfect. And we'll take your oxygenation and heart rate. Go ahead and relax your arm. Okay. This will go on your upper arm. I'm gonna take your blood pressure. Okay, go ahead and relax for me, please. Blood pressure is 118/60. It's perfect for your age. Oxygenation 98% under air, and heart rate is 65. That's also very nice and relaxed. Okay, I'm going to listen to your heart and lungs. Go ahead and breathe normal for me. Is it okay if I put the stethoscope a little bit under the shirt? You can breathe normal. We're trying to listen to your heart. Can you hear only as 1 and as 2? And now as 3, now as 4. Go ahead and take a deep breath in for me. And exhale. And again, take a deep breath in. And exhale. One more time, breathe in. And breathe out. And again, breathe in. And breathe out. Okay, you can breathe normal. Going to listen to your jugular. Go ahead and take a deep breath in and hold it in for 3 seconds. 1, 2, 3. Good. Breathe out. Hold to that one more time. Breathe in. Then hold it for 1, 2, 3. Breathe out. Okay. Very good. Okay, I'm going to have you change into this scalp. And we're going to continue the exam after. Okay. I'm just going to put gloves on. And we're going to start first with an eye examination. And that will allow me to see exactly where your neurological nerves are doing. And also, after that, you can go ahead and relax and close your eyes. Go ahead and look right here. Okay, so we're assessing a pupil size. So looking at constriction. Okay, pupils are round and reactive to light and accommodating. There is no jaundice. Go ahead and look right here for me. And here. Okay, there's a little bit of shaking when you're looking towards the right. Go ahead and look again. Is your face blurry in here? No. Okay. Let's go ahead and check your throat and your tonsils. Give me a big ah. A little bit of redness in the back of the throat. Does it hurt when you swallow saliva or when you drink liquids?
Sometimes, not really though.
Okay. Go ahead and give me a big smile. Good, strong and symmetric. And above your cheeks for me, keep them puffed. Don't let me unpuff them. Okay, relax. Now go ahead and raise your eyebrows. I'm going to try to push them down. Don't let me do that. Okay, very good. Relax. Now I'm going to try to push your heads towards your right. Don't let me do that. Okay, very good. Now go ahead and on the count of 3, I'm going to ask you to shrug your shoulders. Go ahead and shrug your shoulders. Very good. Now go ahead and shrug your shoulders one more time. I'm going to check any lymph nodes that might be enlarged in this area. Go go ahead and cover your right eye. And with the other one, can you hold the Snellen chart? Extend your arm all the way. Can you identify this color?
Red. Green.
Okay. What number do you see here?
9.
Can you read the last row starting with the first letter towards the right?
HPFTL.
Okay. Go ahead and switch eyes. What color do you see here?
Green.
What number do you see here?
5.
Go ahead and read the second to last row, starting with the first letter to the right.
JHDFC.
Okay. And you don't wear contacts, correct?
I do wear contacts.
You do wear contacts. Okay. So let's go ahead and take a look at your ophthalmic nerve. I'm going to have you look straight behind us. Try to keep your eyes open. No redness, no inflammation on the right side. Try not to blink. Perfect. Okay, let's go ahead and check your other eye. You can go ahead and blink now. I know it's not that easy. Good. Okay, go ahead and look up. And now look back on the wall behind me. I'm not seeing any inflammation there. It looks very good. I'm going to go ahead and check your ears as well. Go ahead and turn your head that way. I'll have you relax. Tympanic membrane is pure gray. The canal has a little bit of earwax, but we can definitely visualize. Let's check the other side. Okay. Do the same thing on the other side. A little bit of redness, but it might be due to a little bit of debris. We can definitely try to schedule an ear cleaning and see how that goes. I'm going to check your reflexes now. Go ahead and close your eyes and relax your jaw. Open your jaw a tiny bit. Perfect. Okay, good. Okay, very good. Go ahead and relax your arm for me. I got you. Good. Okay, so we're checking your reflexes. That's very good. That's excellent. Let's check the other arm. Okay, let's relax the wrist. Good. Excellent. Now I'm going to have you relax your arm. I can tell that this is where the surgery was. Go ahead and relax it. Relax the shoulder. There you go. Good. Okay, good. Relax.
going to put your hair up a little bit. So now we can take a look at the skin in the back. Okay, and is it okay if I open the gown?
Yes.
Okay, I'm going to start with a visual inspection. Just a normal hormonal imbalances that could be triggered, and that's exactly what you can see. Is just a little bit of a redness that come and go with the cycle. We're looking for increased redness, raised papules, and lesions. I'll let you know if I find anything concerning. And at any moment you feel any type of discomfort, tingling sensation, or abnormal soreness, let me know. Okay, I'm going to palpate. I'm going to palpate your
spine, starting with the cervical. We're looking for any nodules or abnormal pulsations. Also assessing the normal curvature of the spine. It is normal for the spine to be curved at different points. But we're looking for signs of scoliosis, lordosis. Okay. There's a little bit of an indentation here at the lumbar area. Are you experiencing a lot of back pain, lower back pain?
Sometimes.
Okay, we're going to do a few tests here to see if you can distinguish different feelings. Go ahead and tell me if you feel this vibration or pressure.
Vibration. Vibration. Vibration.
And what about now?
Pressure. Pressure. Vibration. Vibration.
Okay, go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. Warm. Cold. Cold. Warm. Warm. Cold. 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 Cold.
I'm going to take a few measurements. We're looking for inflammation, 48, 43. And that could be triggered by an imbalance. 45, so it's definitely a deviation. 26. 1.5. 39. That's 40. 17. Okay, I'm going to check for any neurological deficits. Just relax your back. Looking for normal pulsations. The nerves run through the paraspinal muscles, and when triggered, we can have a sudden movement. Just noticed one on the right side. Okay, go ahead and tell me if you feel this on the left or right of your spine.
Right. Left. Left.
Sorry, let's have one more time.
Left. Right. Right. Left.
Okay, does this feel sharp or dull?
Sharp. Dull. Sharp. 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 Dull. Dull. dull, sharp, sharp.
Does this feel dull on both sides?
Yes,
Does it feel the same?
yes,
What about now?
yes.
And now?
It feels sharp.
Okay, very good. Go ahead and tell me if you feel this 2 or 1 pressure point.
2, 2.
Good.
1,
Good.
2, 1, 1.
Okay. I'm going to listen to your lungs in the back. I'm going to have you take a full deep breath in and breathe out. Good. Let's do that again. Take a deep breath in and breathe out. And again, breathe in and breathe out. And again, breathe in, breathe out. And again, breathe in, breathe out. Okay. Go ahead and tell me if you feel any kind of pain. Okay, perfect. So what I'm going to have you do, I'll have you lean down now, and we'll take a look at your scalp first and your face. Okay, Amanda, go ahead and relax. I'm going to start by palpating your temporomandibular joint. Also, check your lymph nodes that are preauricularly situated. We're looking for fluid buildup that could resonate to lymphatic fluid. Checking under the jaw, we have submental lymph nodes. Slowly palpating so that in case we do discover anything, we are not disrupting it. To check your sinuses, first starting with the ones in between the eyebrows. Okay. Periorbital socket looks normal. I'm not seeing any circulation problems. Eyes look symmetric as well. Eyebrows. Maybe the muscles could be a little bit tense on the upper side. Okay, slowly palpating right under your eyes. This is where we have the second set of sinuses. Nose is a tiny bit asymmetric. The left nostril seems to be more inclined interiorly. Go ahead and breathe in, breathe out through your nose. Good. So we're checking patency to make sure that there is no obstruction. Breathe in, breathe out. Okay.
So it's a lot better on the left side. Do that again. Good. You might be having a little bit of a deviated septum. Do you know if you snore at night?
I do not.
You do not snore?
I do not snore.
Okay. Okay, slowly I'm just going to palpate the hairline. Not feeling any lumps or bumps. Moving back towards the ears, palpating the mastoid bone. Let me know if you feel any kind of pain as I'm swiping the finger on this region that has no hair. Sometimes we could have like an absent mastoiditis, very little symptoms until it gets just worse. And we want to make sure that we're checking this part as well. Okay, I'm not noticing any earlobe lumps. Moving down to the neckline, just going to slowly palpate. The sternocleidomastoid muscle can be very tense. Palpating trachea and thyroid gland. Trachea is midline positioned. I'm not feeling any nodules on the thyroid gland. Go ahead and swallow saliva one time. Can you do that again? Good. Is it okay if I open the gown a little bit to here? So I'm going to check the neck and a little bit of the chest area. Moving back to the scalp. Just trying to see if there are any palpable lumps on the scalp region. Try to turn your head towards your left, okay? Perfect. Relax. And I'm going to do a detailed scalp examination, which means that I'm taking a look at the skin. Scalp health is very important for hair growth.
overall hair follicle regeneration. I'm noticing some redness consistent with sun exposure. I'm going to check for sensitivity. Go ahead and tell me if you feel this sharp or dull.
Sharp.
Okay, and now.
Sharp.
And now.
Sharp.
Okay, so the scalp is very sensitive. So I just touched you with a dull object. Go ahead and tell me if you feel this cold or warm.
Cold.
Okay. And now.
Warm.
And now.
Warm.
Okay, let's do this one more time.
Warm.
Okay.
Warm. Warm. Cold.
Okay. Scalp looks healthy. The only condition that I'm noticing is sunburn, and it is more consistent on the top part of the head. It's kind of little on the sides. Hair follicle looks normal. I'm going to do a hair pulling test to see how easy the hair breaks. And how sensitive the scalp is. I'm noticing increased redness actually, so there is a little bit of inflammation under the first layer of the skin. I would recommend an anti-inflammatory scalp analysis and treatment. Do that one more time. Okay. Are you experiencing any type of itchiness?
A little bit sometimes.
Okay. And is it localized mostly on the top part, or does it spread anywhere else?
Mostly on the top.
Okay. Alright, I'm gonna go ahead and check your abdomen now. Okay, Amanda, I'm just going to slowly visualize the abdominal wall. Let me know if you feel any kind of pain as I'm doing this. We're trying to take a look at the main organs and see if there is anything that we should be concerned with. Before I palpate, I'm going to take a few measurements to see if there is any signs of inflammation. 35.6. 21.5. 30. 32.5. Okay, I'm going to go ahead and check the skin, see if there is any raised bumps. Now go ahead and tell me if you feel this vibration or pressure.
Vibration. 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 Pressure. Vibration. 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 Pressure.
Go ahead and tell me if this feels cold or warm.
Cold. Cold. Warm. Warm. Cold. 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 Warm.
Go ahead and tell me if you feel this on the left or right.
Left. Left. Right. 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 Left. Right. In the middle.
Okay. Going to slowly palpate, starting with the left quadrant. We're looking for any signs of inflammation, pulsations, checking your kidneys. Any pain as I'm palpating here?
No.
Okay. Just going to slide my hand under your belly here. Just going to palpate. Try to relax your abdomen. Okay, let's go ahead and check the other side. We'll do the same thing. Go ahead and relax. Relax. We're doing percussion to understand if there is fluid or solid in the abdominal cavity. It also helps to determine if there is an enlarged organ. gonna have you stand up and we're going to talk about the results.
Okay, Amanda, everything looks good. I'm just going to have you come back in 2 weeks so that we can discuss the results of the x-ray. We're going to take an x-ray of the lower mid-back. I want to see if there is any shift or deviation of the lumbar spine, which could explain why you're experiencing so much pain. Okay. Do you have any questions for me before we go? Okay, perfect. I'm just gonna sign this for you, and if you don't have any more questions, then I'll see you back in 2 weeks.
Awesome.
Thank you.